Hello, that's Chad from Carl Roman Respiratory Care. This is going to be a quick tutorial on heated high flow nasal cannula oxygen as this pertains to our facility. We have actually dabbled in heated high flow nasal cannula oxygen for years and years, well over a decade. We used to use an older system. It was a Fisher-Paykel system. It was very noisy and decently efficient. But in the past few years, we have, through a significant amount of research, discovered this unit, which is the Vapotherm, which is a heated high flow system. It's very quiet. It's incredibly efficacious and very effective, especially with our COVID population of patients who are hypoxemic. So what I'm going to do is I'm going to kind of go into some of the physiology behind how this thing works. We'll talk about a few numbers, and I'll keep this nice and short and sweet. So the difference between oxygen devices and a device like this is an oxygen device, a mask, a non-rebreather, or even a nasal cannula. It just provides an oxygen-enriched environment. It doesn't actually, I mean, you can treat hypoxemia with it, but it isn't actually helping any of the diseases of the lung. And that's where this kind of comes in. Not only does this provide the patient with oxygen-enriched oxygen, but it also provides that inspiratory flow assist, and that's very important. So as a patient is taking a breath in, we call that their flow demand. And if they're short of breath, that flow demand, if you could meet that flow demand with a high flow device, you will decrease shortness of breath. So effectively, with the high flow nasal cannula device, the Vapotherm, you are achieving that flow demand. So that's one side of it. And then you have FiO2, which will help to treat hypoxemia, obviously. And then we obviously can heat it. You can see the 33 degrees Celsius, and that is set for patient comfort. The other significant thing, as it turns out, the pulmonary system is inefficient in a way. As you exhale out all of your air, your lungs do not collapse. You do not remove all of this waste or carbon dioxide. It actually permeates into the tracheobronchial tree. And then as you take the next breath in, you mix good air, room air, with all of this carbon dioxide waste. But in the healthy lung, it doesn't affect efficiency. But as you progress into lung disease or the COVID, when your lungs are down, that mixture of what we call dead space ventilation does affect gas exchange significantly. So what this device will actually do is at those high flow rates, it'll actually wash out this dead space or carbon dioxide waste that is in the upper portions of the large airways of the tracheobronchial tree. So what are we doing with this? We're treating shortness of breath. Because it has a high flow, we can meet flow demands. It's washing out carbon dioxide, so you can improve gas exchange, and it is providing oxygen, so you can treat hypoxemia. And that is essentially the components of the heated high flow nasal cannula oxygen, or the Vapotherm, which is the device we're using. Let's talk about flow versus FiO2. So those are the variables. For instance, it's very easy to manipulate. There's one button. You push it, and you can toggle between your three settings. So as I push it, it's FiO2. You can turn it up and down. Then you have temperature, and then we have flow rate. Now, here is the circuit. We do have a water source, because it's heated high flow humidity. So let's just go to flow rate. Now, flow rate on the Vapotherm maxes out at 40 liters a minute. And what we generally set this to is we're monitoring the patient, and we're trying to get as much flow rate in there as possible to wash out carbon dioxide, but not to be uncomfortable for the patient. And that's kind of how we know. We keep increasing it until the patient starts to become uncomfortable. That means we've met their flow demand. And then, so we adjust flow rate based off of dyspnea or shortness of breath, and we manipulate FiO2 based off of their level of hypoxemia. So, one of the questions out there is, how do we know which one to wean, to titrate, turn up, turn down? Well, you're monitoring two things. You're monitoring shortness of breath, that's your flow rate, or you're monitoring monitoring hypoxemia, and that's going to be your FiO2. So, for instance, you have a patient who is complaining of shortness of breath, but their oxygen saturations are 100%. That's great. You're going to optimize flow for shortness of breath, and you're going to be able to wean FiO2. Or you have a patient that isn't complaining of shortness of breath, but their SATs are 90, 91. Well, then you can decrease flow rate and keep their FiO2 wherever it is to meet your oxygen therapy protocol, greater than 90 as general. So that's kind of how we adjust the settings. And again, temperature based on patient comfort. I think that pretty much sums it up for the Vapotherm. I hope this was helpful. This is from more of a nursing standpoint for our nursing partners here at the Carl Broman Medical Center, and hope this helps out a little bit. Take care.